This guy always makes headlines every time he comes on the show. We are joined now by Chief Greg Flynn of the West Bloomfield Fire Department joining us via Zoom. Hello, and you're in your office today. You're not sitting on a fire truck or some other exotic location. You're there at work today, Chief Flynn.
We are. I'm Zooming all morning, so I'm Zooming from one meeting to the next. That's the world that we live in right now. So I go home, and that's what I hear about from my kids and my wife too. They've been Zooming all day long.
So I'm just going to do the easiest thing a radio host and TV host ever did. I'm just going to get out of the way and ask you a very open-ended question. So what's up? So you've been on all these Zoom meetings today. What's the news? What do we need to know today, Greg Flynn?
The headline for us today is the governor's press conference yesterday that she opened up the phase 3 and phase 4 asymptomatic, non-symptomatic testing for first responders and other essential workers. This is a huge thing for us. I think it speaks to two things. Number one, the importance of testing those that are out there in the workplace right now. And number two, the availability of testing. And those are two welcomed changes that we have before us here in the great state of Michigan.
Yeah, and we heard the same story yesterday from Dr. Russell Faust, who is the head of the health department here in Oakland County. And you've probably talked to him before. He is a very impressive physician. We were really happy to have him on with us yesterday. And he said, yep, first responders, come on down. We'll get you tested right away. Is that having the very positive emotional impact one would expect with our first responders as well?
It is. And David, you've watched this story develop over the past 5 or 6 weeks now. You can see just how quickly information comes out, and then unfortunately, or how quickly we hear about something developing, and then the amount of time it takes to become reality. And the diversity of the guests that you've had on the Megacast speak to, I think, a better understanding of how all of those changes impact our community. But, I had one of my crews in the morning briefing say, Chief, we're hearing about Detroit doing the Abbott lab testing, the 15 minute or so testing, the very quick testing. Why can't we get that? Those things just get talked about and highlighted in the news like they're just everywhere. And that's not the case. And everyone leaves out the price tag and who's going to pay for it and who's going to operate it. And, there's always more to this story than just the headline.
Chief Flynn, and that's why we do this show. And that's why I appreciate you coming on, because this has been a no BS platform. We just called it the way it is because what else are we doing here, right? And you do get a very 10,000-foot level perspective from the national media and even from the governor, because that's what they have to cover. So here on the show, we gut check it. What's really going on? So to that end, Dr. Faust said, you can get a check. Yesterday, he said on the show, you can get a check, and it can happen in about 24 hours. It's not going to be 15 minutes. So they've got a lot quicker testing. I mean, let's be honest. At the beginning of this thing, Greg, we were waiting, for a week and a half for results. If we get results in a day or two, that's pretty darn quick right now, wouldn't you say?
It is, and that highlights just how quickly the healthcare professionals have ramped things up, how our folks working in the lab have really risen to the task of processing the number of tests. Now, keep in mind, the tests that we're administering right now, to the best of my understanding, Dave, is we're looking at that snapshot, when that swab was taken, whether or not you are positive or negative for COVID-19. That's all we're doing. So that doesn't imply that you never will be tested again. And that's something to keep in mind, different than the antibody test, which you're hearing about. And we hear about these things because these are things that I believe that they do for other viral infections or other infections so that we can see what your body's immune system is doing. So we just intuitively think, well, hey, just do it for this one too. And magically, this all just happens. And the other reality we're getting from this is truly our dependence on our scientists, our clinicians, our researchers that make sure this is all happening. And I know when you have folks from the school district on and things like that with Dr. Hill and other folks that are professional educators, that this is where they're pushing, for having more of these folks and careers. And this is the kind of impact you can have. I will say, we're hiring at the WBFD. And
Okay.
you can imagine right now the complexity of trying to get applications right now with Township Hall that is following the governor's executive order and is shut down. Testing that we need done of our applicants, whether it's a physical agility test or a written exam, all those facilities are shut down. So there are definitely challenges out there. I throw that last bit in. I know I went down a rabbit hole there, but this idea, though, that we need these professionals, that's the impact you can have on a community. And
Well, let's just take 30 more seconds. We can do your recruiting on my show. That's okay. Let's take 30 more seconds and talk about that because, look, based on what the information we have right now, Small Business Association of Michigan, Rob Fowler, 10 minutes ago said 14% of the businesses are at risk. That's just an opinion survey from businesses. And, we got 1 million people laid off right now or collecting unemployment in Michigan. If a couple of them are listening or watching this morning and they thought, hey, maybe I'd want to be a fireman, now's a good time. It's a good time for a career change because you are hiring, and I assume other fire departments are as well.
We are, and unfortunately for applicants for our jobs, we do have a series of criteria that you need to meet. You need to be a paramedic already. We'll send you to fire school. We will. So that's a 7 or 11 a week academy style program, and they'll teach you everything that you need to know. And then we'll put all that to work here in serving West Bloomfield, Orchard Lake, Sylvan, and Kego. But there's always an opportunity for that. And I think sometimes even as an employer, that role, taking off kind of the emergency manager, fire chief hat here and looking at just as a manager, finding some of those folks that have brought rich career experiences from other places into the FD can make for a great addition. They appreciate maybe the work environment a little bit differently than somebody else because they've worked outside swinging a hammer in construction or have taught kids in school or, whatever, some of these other jobs that are very, very stressful jobs, just like sometimes emergency services can be.
Chief Flynn, you're on the front line. Just curious, what's it like? Are you seeing calls up, down? We hear and we see the statistics now that fewer are infected. We're starting to finally flatten that curve a little bit. But I always like to hear feedback from the front line on a day-to-day basis and the people who are out there. Are you seeing the flattening of the curve with regard to your operation in the West Bloomfield Fire Department?
Yes. We'll jump on board and say that we are seeing multiple data points, multiple days that we start to feel comfortable that there is some flattening. Now, like I've said before, flattening does not mean it's gone. And I think we start to use some of these terms like our goal was to get to flattening the curve. That was our next objective. And we feel like we've reached that. And a sigh of relief. No, we're not done. This is just one of those milestones that we needed to get to, and we've achieved that. Why? As you have highlighted so many times before on this program, thanking the residents, thanking the community, thanking the businesses for the struggles and the hardship that they've taken on to get us to this point. Now we need to finish this thing out, though. And while we're seeing fewer calls, we still are seeing very sick people. So yes, the call volume, yes, the shock, yes, the campaign of saying, call your doctor, don't call 911, call your doctor, don't show up at the emergency room. All of that worked, Dave. It worked and continues to work. But we still have very, very sick people. So maybe every ventilator is not being used. There are still people on ventilators. So while I celebrate with the community that we're doing a good job, we need to be careful that we continue to push.
Well, we do.
Keep doing the things we're doing.
We do, and I think it's inevitable that unless something surprising happens medically, that this is going to open up a little bit. That's the next phase. So governor, legislature, other organizations are talking about it now, and we'll know. We've only got 10 days left before the governor's orders expire, and there's going to have to be a new set of orders and around the country. We saw a couple of states already starting to loosen things up, and it's going to happen here in Michigan at some point in some way. And then now it's back on us. It's back on the people. We're going to have to, as we start going into theoretically going into restaurants, businesses start opening up. Maybe the gyms start opening up. Wherever it is you go, the coronavirus is still out there, okay? So we want everything to open up. Well, now you got to behave yourselves. You got to take everything. You got to wash your hands. You got to do all these things. And I think people are up to it, but I think we're going to make some mistakes, and we're going to need some help, and some people are going to trip a little bit. But, listen, we can't leave everything closed down forever. We got to trust people. And I think you guys the first responders have done us an amazing service. You have shown us the way. You really have. The first responders, the folks at the hospital, people that are just staying at home. They've all shown us the way. Now we got to follow. And I got faith. I think people can follow, but it's going to be an interesting couple of months.
I love the message, and I'm on board with you. I believe that our community, I've said it before, an informed community is a responsible community. And that's where we live here in the greater West Bloomfield broadcasting, the far reaches of the Megacast. That's where we are, Dave. And I think that's, I don't want to, dip my toe in the political pool here, but it's very difficult to talk about reopening without the politics being injected into the conversation. And I think that's where so many of us get frustrated, is it's not the politics. I'm concerned that, one of my favorite lunch spots to go with the crew here, the Golden Phoenix, I want them to open. We like the staff there. We like supporting them. And I'm genuinely concerned about the restaurants in our community that so many of us love to go to. I want them to be open. We're anxious to go back out to lunch here in fire administration because that's a way of giving back. And so, we do need to navigate that. I think we do need to give more credit to our residents and the people that are out there. And there's a very delicate balance there, right? Of giving them credit so that they also don't tip too far another way with a radical approach that can be disruptive. So we need to find that balance. And that's where I think the governor has a very difficult job. And, leading a small group in comparison to what the governor's trying to lead, I do have an appreciation for what she's trying to accomplish. And I heard one of our elected officials say in the board meeting last night, we need to support our governor, and we do need to find balance in that support. We do need to be behind her as she's trying to achieve an outcome that we all are behind, which is more lives saved. But we also need to make sure that we're getting those communities and those businesses back up and running, which is also going to impact lifestyle.
Well, one of the things that I find so rewarding in doing this show, sorry to interrupt, one of the things I find so rewarding in doing this show and that I've experienced over my broadcasting career is that for the most part, not entirely, but for the most part, things get a lot less political as we get more local. And you'll see that as you go into your local boards and commissions. It's not always obvious who's the Republican and who's the Democrat. Sometimes you got to tear that apart when you look at things really locally. We don't always know. So I think that's good. Clearly the president and Nancy Pelosi and our governor and our legislature, we know who they are and where they are. But I'm really, I'm pretty happy today. I heard the governor on Paul W. Smith's show on WJR. He asked her Republican questions. She gave him Democratic answers. They had a really good conversation. That's good. The governor is going to be on the Small Business Association of Michigan's conference call this afternoon. That's good. No one's got the answer. And I do give the governor a lot of credit. Here's what I give her credit for. It's impossible to write these rules. So if she got it right or wrong, you got to give her a break, okay? If you think she got it wrong, you got to cut her some slack because you go and try and write the rules. And then at least have the conversation. Try to have the conversation in a civil way. And, she's had some moments where she's got a little irritated. I think we all do during difficult times. And then I think people have gotten a little irritating too. So we'll see what happens. I urge everybody to just leave the partisan stuff aside and let's go figure it out because it's going to be a lot harder to put this thing back together. Humpty Dumpty is a lot harder to build and put back up on that wall, and that's what we have to do right now. Where do you see the fire department, our local officials, the other fire departments across our area, what's their role as we try to put this thing back together, Chief Flynn?
I think we're defining what that role looks like moving forward. We're navigating right along with everybody else, Dave, and where people are stepping up and stepping into the challenge. That's just what the FD is doing as well. What is the next unknown? How can we contribute to testing? I've got a group of men and women here that are medical professionals that may play a role in that, and that are mobile and that are equipped to be in all kinds of weather and all kinds of terrain and can go anywhere, right? So we need to be inviting opportunities for reaching our objectives and looking maybe for out-of-the-box solutions for how we achieve that. And just because someone isn't wearing a set of scrubs doesn't mean that they're not going to be able to help with the solution. And you're seeing that. I saw a volunteer group, Assistant Chief Andy Besnow retired from the fire department not too long ago, and I saw on social media they're doing making gowns for first responders out of visqueen, a plastic material, and they give folks a pattern and they pick up the materials and they go home and they make the gowns, and then they make 20, let's say, or 30 gowns out of this roll of plastic, and then they drop them back off, and then someone distributes those. We are creative. We are innovative as a community, and we're going to figure that out. And the FD is part of that. And I know that you've had Director Tucker on from Parks and Recreation, and I've had conversations with her, and they're looking at their team and how they can re-engage some of our most at-risk population. We know that our seniors are at risk for the disease, but we also know they love coming together as a community. So how can we continue to do that? We're very focused on our extended care facilities, and we include our nursing homes, independent and assisted living facilities in that, Dave. And we're going to work on stronger partnerships, even stronger partnerships with them, and what the FD may be able to integrate into their system so we can combat COVID-19 inside those facilities.
We look forward to hearing from you on that. Let us know, if you don't mind, and you could share with us what those partnerships look like. A very quick question. Are they getting the testing they need in those facilities? Are we to the point now where we can get everybody tested in there to make sure we know the status of everyone in all of those facilities?
So I hate to do this to you. I'm not equipped to answer that one, Dave.
Okay.
I'm not in tune enough to know what their interfacility testing is like. I do know that they frequently can send people out, or they're getting test results back, and then we're transferring patients over to the hospital for more definitive care. So there is a system in there. We just need to figure that out. I think what I might need to do, we might need to take the Megacast into the back of an ambulance here, and we'll get you guys.
Can you think I could do that? I mean, if you want to do that, I could do that. Would it be safe? Are we putting any lives at risk if we do that, including my own?
Well, yours, yours would probably be the life that we'd have to be most concerned
about.
All right,
well,
maybe we can talk offline to see if we can get you. It'd be nice for the community to see a little bit of.
I'm up for it. I'm up for it.
The decon process and what it looks like through that lens on the front lines.
I'm up for it.
We can explore what that looks like.
I don't want to bring a photographer because I don't want to take any additional risk, but I can do it with my cell phone and Zoom, and we can just run around and do it live. And Tyler, if you can hold the fort down someday here, maybe I'll just spend one day making runs with the fire department. Is that okay with you?
I'm fine with that.
All right, Chief.
Tyler had me sweating the other day while you were gone. Tyler popped up, and I was beating up pretty bad.
He's doing a really good job. He doesn't need me here anymore. All right, Greg, we got to run along. Thank you very much.
Okay,
I appreciate it.
Good. Thanks, guys.
Greg Flynn, West Bloomfield Fire Department, one of our great fire department chiefs here across our Oakland County broadcast area.